Welcome to our office. I'm Dr. James Rota. I'm 75-year-old. I'm a practicing dentist, have been for 45 years. And I'd like to share with you, especially you dentists, some of the things that I've been doing to respond, to react, to defend myself against the many occupational hazards that I've been experiencing in dentistry. In my early days in looking at the ergonomics of dentistry as an assistant professor at UCLA, we found that there were a lot of occupational hazards like varicose veins. We didn't realize the other toxic effects that dentistry was having in the areas of the aerosols that are created in the environment, containing bacteria, toxins, and many of the things that we now know are irritating to our body in a most destructive way. But today I want to talk primarily about what I've been doing when I'm asked, well, how have you been practicing for 45 years? When some of the statistics that we see in dentistry show that many of us leave the profession as a result of back problems associated with our various postures that we take, sometimes over prolonged periods of time, in very strained, focused positions that not only strain the eyesight, not only strain the skeletal muscle system, and really block circulation in areas of the body that are under tremendous pressures. And we're just beginning now to see the basic diseases that are related to sitting down over prolonged periods of time, exposing the lower body to a lot of the congestions and a lot of the nerves that are pinched off as a result of not only lack of circulation, but by the vertebral bending and pinching sometimes the nerve, the sciatic nerve that goes down our legs. So not only are we not troubled today with the varicose veins, we are now troubled with some of the various back disorders related to the sciatic nerve impingements, and now the focus on the prostate area. What I'd like to do today is share with you some of the things that I've been doing that not only have responded to the occupational hazards in dentistry, but also have been my key in dealing with the mercuries that I've been breathing over the years to detoxify myself of this very deadly material that we didn't know too much about earlier, but we're finding out now how toxic it is to the dental profession. And what I've done to detoxify myself, not only in the foods that I ate, but the movement, that exercise, that which we call the lymphatic system, which is really a vital part in our healing process. The lymphatic system has to do with the cleansing of our body with those circulated areas that are blocked.
In our office, the staff, including myself and Annette, our hygienist, will take a few minutes throughout the day to release some of the physical stresses related to our services. A good time for us to regain our energy and is while waiting for anesthesia. Before we return to the patients, we can relieve some of the physical as well as some of the psychological stress with a gentle bounce. I really find bouncing clears my head as well as my body. This also enables us to activate our lymphatic system and greatly increase our ability to detoxify with our body. Now, as reported by the Journal of the American Dental Association, various body movements are suggested to reverse the physical burdens that we're experiencing in dentistry. We will demonstrate a few of these exercises that address the body stresses when getting into a dental position at the chair. By extending our arms slowly, moving downwards, while gently bouncing, this addresses the shoulder areas and the chest. With the use of the bar, we can do squats and very effective and stretching to relieve the lower back and the pelvic area. Because of our leaning over the patient, we dentists are often affected by curvature of the spine. By pulling our shoulders back while performing a gentle bounce, it feels like a massage, and it's good for our posture as well. With tensions from above, I have found that I can relieve the symptoms of carpal tunnel syndrome by using the resistance cords in this manner. Now, with regards to whether we bounce with or without shoes, I have bounced with and without shoes, depending upon what my objective is in that moment. But for optimum therapy, we have found that bouncing without shoes that often confine and stress our feet takes advantage of the specially designed mat that can facilitate the release of those pressure points at the bottom of our feet, as well as promote circulation in our legs, and it also feels great. I also use the Freedom Spring at home, which has been very effective in my total body workouts and aerobic training over the years. In fact, I have trained for the Senior Olympics, and I have taken home the gold in discus and in javelin. So, there you have it. I call my secret to maintaining my health and longevity in dentistry bouncercise. And I trust this exercise system will become an important part of your proactive health program.
Hi, I'm Dory Rota, and I'm very pleased to have been part of the development of the Freedom Spring.
We have assembled a package especially for the dental professional. The Freedom Spring system includes a gym-quality, specially engineered mini-trampoline or rebounder featuring a functional trapezoid shape. It also includes a resistance system which consists of a suspended bar for various exercises, stretching, and stabilization. The resistance cords feature 3 different strengths to suit the needs of the individual user. The Freedom Spring system may be installed in a doorway, or a wall mount is available for more installation options. Please contact me with any questions and to receive your professional courtesy discount. You may also visit us online at dentisthealthyself.com. We are pleased to share our successful response to the many occupational hazards in dentistry, and we will look forward to joining you on your journey of good health and rejuvenation.